Good evening. I'm Dr. Robert Peppercorn, and this is the Yuba Sutter Medical Explorer. As a specialist in skin diseases and allergies, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. Our program tonight will take us behind the scenes of one of our area's busiest pharmacies as we learn about the amazing ways that computers can assist pharmacists and physicians in protecting your health. Also tonight, I will give you some valuable tips that you can use if you feel that you suffer from the annoying symptoms of allergies, such as sneezing, running nose, or itching, burning, watery eyes. Tonight's show will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, we'll look at the latest medical news. Are insurance costs going to go up? Insurers said recently that higher life and medical insurance bills loom for everyone unless AIDS victims pay premiums to reflect their below-average life expectancy. Insurers want to test new applicants who fall into AIDS high-risk groups and charge more if they carry the AIDS virus or show the disease's life-threatening symptoms. Insurance firms say it's no different than charging more for heart or high blood pressure patients as they do now. Florida and California, however, bar the use of AIDS tests to determine consumers' liability, insurability, or rates. Northwestern Mutual Life Insurance Company will pay an additional $100 million in claims by 1991 because of AIDS. According to insurers, without AIDS testing prior to issuing new policies, all health and life insurance premiums will have to rise. The largest investigation ever into links between birth control pills and breast cancer provides very reassuring information on the safety of oral contraceptives used by millions of American women, according to a new study. The new study shows that there is no evidence that the birth control pill causes breast cancer, even among women who might already be at higher risk than usual. Breast cancer is second only to lung cancer among the fatal tumors of American women. It will strike 1 in 11 during their lifetimes, and this year the American Cancer Society estimates that 123,000 new cases will be diagnosed. The results of the new study show that taking the pill for 15 years or longer does not increase a woman's odds of having the disease, even if she has a family history of breast cancer. Other studies show that the pill actually seems to reduce the risk of cancer of the uterus and cancer of the ovaries. Experts caution that it is still years before all doubts are settled about the lifelong effects of the birth control pill. For the latest information about the risks and benefits of birth control pills, you should discuss them further with your specialist in obstetrics and gynecology. Finally, in the medical news is new information about heart disease. Heart disease is becoming an ailment of the poor, according to the president of the American Heart Association. By the end of the decade, it's likely that socioeconomic status may be one of the most important risk factors for cardiovascular disease. Studies have shown that upper and middle class whites have enjoyed the greatest improvement in heart health, while poor people and blacks have not shown the same decrease in death and disability due to heart disease. A new study showed that people with less education and lower income had the highest rates of heart disease. Other studies have shown black Americans are 2 to 3 times more likely than whites to suffer high blood pressure and strokes. The investigators showed that access to care was not the cause of the increased disease problem. Rather, educational efforts to reduce heart disease fatalities by quitting cigarette smoking, improving diet and controlling high blood pressure, obesity and stress have been more successful among whites than among blacks, and more successful among white-collar workers than among blue-collar workers. Now, on with the Medical Explorer. On past editions of the Medical Explorer, we have seen many of the ways that computers have assisted doctors in the diagnosis and treatment of disease. Tonight we will learn about the new ways that pharmacists have begun to use computers. Let's leave our Medical Explorer studio here and visit the Medicine Shoppe Pharmacy in Marysville.
Dr. Peppercorn, how are you?
Bob, how are you today?
Good. Welcome to the Medicine Shop.
It's my pleasure. I'm really interested in, Bob, in the latest developments in the use of computers in pharmacy. What are you going to show us today?
Well, today we're going to show you the technology and how it's used for pharmacy. We're going to exclude all the business applications.
Like insurance forms and Medi-Cal forms.
We're just going to talk about drug interactions, some allergy screenings. We're going to see how patient profiles can be printed out. We're going to talk about how we would use our computer in case of a drug recall. Things that will be of importance to the patient as regards their health and how it relates to pharmacy.
Well, I'm really looking forward to this, Bob. Can I come behind your lock counter this time?
Well, do you have your ID card with you?
Yeah, I actually do. I can show you. Okay.
Well, then we let you in this time.
All right.
Hi, Pam. How are you?
Fine, Bob.
Got a couple of prescriptions today? Let's see what you got here. Okay, one for your grandmother, and it looks like you've been to the dentist, so you've got one.
Yep, it hurts a little.
Yeah, okay. Well, we're going to get you taken care of. It'll be about 15 minutes. We'll have them ready for you.
Thanks, Bob.
You bet. Dr. Peppercorn, we have a couple of prescriptions here today that the young lady's just given us, and what I want to do is start with one and show you how we enter it into the computer itself, and then we'll see what develops from that point.
Great. Is this a special program for the pharmacy, Bob? This isn't like someone buying their own IBM PC and then being able to do this sort of thing at home.
No, it really isn't. It's designed by a company back on the East Coast specifically for pharmacy. It's called the QS1 system, and it's probably one of the best systems for pharmacies on the market. It's probably 2,000 pharmacies that are using this system now. First thing we do is we put the patient's code into the machine and we draw her file up in front of us. And because it's a new prescription, we're going to build her prescription, and that just simply means we're going to type it onto this screen from the prescription that was written by the doctor.
Why don't you just tell us what you're exactly putting in there as you do it?
Okay, we're going to say we're going to take one tablet 4 times a day for 12 days. There aren't any refills authorized. It was not phoned in by the prescription. It was written. We're going to enter the doctor's name, which is Dr. John Doctor in this case. And it will be a 12-day supply, and we enter it by pressing this key. Now what we have here on the screen is it's showing is that Jane Doe is getting a prescription from Dr. J. Doctor. Take 1 tablet 4 times a day for 12 days. The drug is erythromycin, 250 milligrams, 48 tablets. Now, this prescription has not been accepted by the computer yet until we press this button.
What basic information have you already entered about the patient herself?
Okay, the patient has already had a file built which indicates where she lives, her sex, her birth date, if she's on any third-party prescription programs, insurance programs, any drugs that she may be allergic to. All of those types of things have already been in there. Now, what's happened here is we see a screen that says allergies and interactions. The computer has a program called Drug Interaction Screening, which will take a look at the drug that we just put in to fill and base it against all other drugs that are currently in her profile that she may still be taking, and it will show us if there's going to be any interactions between the 2 drugs. And what it's showing us here now is that with erythromycin, which we want to give her the antibiotic, it's going to interact with theophylline 300 milligram, which she got filled on 7/23/86. So we are certain at this point that she's still taking that medication because she just had it refilled. So what we have to do now is we have to assess the interaction, and if we do not know right off the top of our head what that interaction is, then we have a couple of books which we refer to, which are designed around this system, which give reference points and tell us exactly what the interaction is.
Now, if she was taking a drug that wouldn't have any interaction at all, it wouldn't have flashed on the screen here.
That's correct.
So the system already knows which drugs interact with each other.
That's correct.
And gives you that information. That's an important piece of information for you.
What I like to do in this case, the interaction here is that when she starts taking this antibiotic, within roughly 36 hours, the blood levels of her theophylline are going to begin to rise because the erythromycin won't allow the theophylline to be eliminated from her body as readily as it normally would be. And she could get some toxic symptoms from the theophylline buildups, things such as headache, nervousness, nausea, vomiting. And if she's a heart patient, she could get some tachycardia, fast heartbeat, palpitations, those things, which would be could be extremely dangerous in her case. So I want to go to her profile and see if there are any heart medications involved in this. This shows her profile, and yes, she does have some heart medication that she is taking. So to me, this could be a very serious situation, and the way I would handle it would be I would call the physician and let him know what the interaction is. And then there are several options. If he had recently done a blood level on her theophylline and knew it was quite low, and he could figure there wouldn't really be a problem. Or he could say, let's cut her theophylline dosage down while she's taking the antibiotic. Or we could change to another antibiotic.
What other heart medicines was she taking?
She's taking Lanoxin 0.25 milligrams, and she's taking one a day, and she just had that filled on 8/6.
So that makes you pretty sure that she's still taking it now.
Definitely.
So the key to the system is it picks the drugs that can react, and that clues you then to go back in there and see what's going on.
That's right.
So you still have to have the human factor.
You have to have the human factor, yes, because these things are not cut and dry, and we always, if we feel there's a potential danger here, we're going to call the doctor. So normally then he's going to tell us what he would like us to do in this situation, and then we will follow his wishes. We will communicate with the patient if he wants her to stay on these two medications. We will relay to her some symptoms which she could possibly experience so that if she does, she will know to call him and let him know immediately.
And do you foresee a day when people might have a computerized little prescription card with little codes like at the supermarket and go up to a machine at the supermarket and the doctor already fills out his part, sticks it in the computer, and automatically the drug comes out of the machine without needing pharmacists?
Well, I don't foresee that, but interestingly enough, there is a program right now that is very similar to what you're talking about, where it actually links the pharmacy computer with the computer in the physician's office, and he can just call that patient's profile right from the pharmacy's computer and see what's going on. So yeah, there's some interactions, some things going on.
So we really don't know what the future holds, though. It can get more and more complex.
Not really. Why don't we leave this prescription now and go to the second one that Pam brought in. She's been to the dentist today and has some dental pain. And we'll put hers in and see what we get from there. So we'll put in her code, brings up her name, Pam Smith, and we're going to enter a new prescription for Darvon compound 5, which is a pain medication. She's going to get 15 capsules. Take one capsule, 4 hours, PR, and pain, which means she's going to take one every 4 hours as needed for pain. There are no refills. The doctor is John Dentist. And it'll normally be about a 4-day supply. Okay, so what we have here is we have her screen, and we've built the prescription. It tells us that she's going to be taking Darvon compound 65. She's getting 15 of them. And it's going to read, take one capsule every 4 hours as needed for pain, may make drowsy. Now also you'll see over here that it says allergies, A. Pharmacist just had to answer the phone, or for some reason was distracted from this screen and he went to fill it. The computer will not allow him to fill this prescription. He cannot physically fill it, and it tells him why. It says patient is allergic to the following ingredient, aspirin. Now what's happened here is this system is designed so that it not only looks at the drug, such as Darvon compound, but Darvon compound has 3 ingredients, so it actually looks at each ingredient within the drug to see if the patient's allergic to any of those ingredients. So that's called basing it on ingredient for screening, and that's what it does. So if we have put in her screen all the drugs that she's allergic to, and she communicates to us every time she has an allergy to a medication, and we get it in there, which we try to do, then she is really protected against getting something that's going to create a problem for her.
Now, to make it more complicated, though, what happens if someone's allergic to penicillin, and then you take a drug that might react with penicillin, such as Keflex, which in most cases will not cause a reaction, but might? How does the computer handle something like that?
The computer handles cross-sensitivities, and that's exactly what you're talking about. It is geared to look at not only penicillin, but also other related antibiotics that a person may have an allergy to. And yes, it would indicate here, patient is allergic to penicillin, to remind us that yes, there is a chance that she could be allergic to that Keflex, and we would discuss it with her or her physician before we turn that prescription over to her.
But it won't prevent you from writing that one for her?
No, no, it won't do that. Okay, now what we would do in this instance is we would call the doctor, and we're going to presume that we did call a dentist and we discussed this with him, and what he is said to do is give her Darvon 65, which is the same medication but without the aspirin. So we're going to escape out of here, and we're going to go back, and we're going to do that for her and build the prescription so you can see how that works.
What are you entering there?
Okay, Darvon 65 milligram. We're going to give her 15 again. She's going to take one capsule every 4 hours as needed for pain. There are no refills. The doctor is John Dentist, and she's going to be using that for approximately 4 days. Okay, so now it allows us to throw it up there. It still shows that she's allergic to aspirin. We go ahead and fill the prescription, and it will fill it. The printer is now printing this information out in a hard copy for her. The reason the computer allowed the prescription to be filled is because the aspirin is no longer in the medication.
So you have not now been forced to actually type out a label, which is what used to take so much time.
That's right. We no longer have to do that. What I want to show you here is what it has printed out. Here we have a receipt for the patient. It tells who the patient is, the doctor's name, the address of the patient, what the medication was, and the price that they're going to be paying. Here is the label, which is going to go on the bottle with the full instructions. And over here, this whole piece here, and I'll just tear this off here so you can see this, is what we call patient counseling. Now, patient counseling is something which we think is very, very important because we try to discuss with our patients things that we think are important that they should know about their medication before they actually go home and start taking the medication. But when you talk to somebody and communicate verbally, usually you lose 50%. By the time they get home, they have forgotten a lot of what you've said. So this supports what we have told them verbally so that they have a hard copy at home and they can refer to it, and hopefully they will be taking that medication the way we want them to take it. What it shows here for this particular drug is it shows who it's for and the name of the drug, the doctor and the date, and the prescription number. It says may cause drowsiness, alcohol adds to the drowsiness, best to avoid alcohol, and this one I think is especially important. Consult pharmacist before using with other drugs. And I have people who will take a medication home and call me and say, I'm using an over-the-counter product. Is it okay to take it while I'm taking this prescription? So this is a very useful message that we use. Up here, we have a message which we can change, and we do from time to time. The one we're using today says, watch the Medical Explorer August 22nd and 29th, cable channel 5, 7:30 p.m. for the pharmacy corner. So that's something that we're utilizing.
We like messages like that on your prescriptions.
I thought you might.
You actually could you could have less employees here with a system like this, couldn't you? You could actually cut back a little bit.
No, Bob, it really doesn't work that way. We just kind of generate our energies into other areas, really. We're more in tune with our customers now than we ever were before because we have more time to do that type of thing. But no, it does not eliminate employees. So, Bob, what I've tried to show today is some things that are of value to our customers, not the business aspects of the computer, because those things are pretty much common for any type of business. These computers will do all of those things. But what we wanted to show is, from a health standpoint, what it can do for the patient.
It's fascinating how computers continue to help us in all of the fields of medicine.
Oh, absolutely, and it just keeps getting better. This system's been enhanced 3 times, and we've only had it 6 months. So the company's out there working very hard for pharmacy, and we're proud of that.
Thanks a lot, Bob.
Thank you for coming.
Again, I'd like to thank Bob Church for demonstrating his new Medicine Shoppe Pharmacy computer for us. More and more pharmacists in our community are now making use of pharmacy computer technology to protect your health. Many of you have been writing to me asking for more information about the ever-common allergy problem. It seems that 1 in 5 people in this area suffer from at least one type of annoying allergy disorder. Let's learn more about allergy as we watch this interesting videotape on the subject of allergic rhinitis.
Runny nose, stuffy head, nagging cough. Is it like a summer cold, a cold that just won't go away? Well, we can't offer a miraculous cure, but we can give you some helpful information on one of the most common causes of these miserable symptoms: perennial allergic rhinitis. Allergic rhinitis. It sounds like a dreaded disease from a TV medical show.
Doctor, there's no use trying to deny it. What we have here is a clear case of allergic rhinitis.
Fortunately, allergic rhinitis isn't dreadful at all, though its symptoms are. Many people, perhaps you among them, suffer from this annoying and often chronic condition. Those suffering from allergic rhinitis may have nasal congestion, headaches, loss of taste and smell, and generally may feel miserable. Rhinitis is the medical term for inflammation of the mucous membranes of the nose. In fact, the Latin root of the word, rhino, means of the nose. Rhino, as in rhinoceros, which is what you may look like when suffering from allergic rhinitis. Allergic rhinitis is a type of rhinitis triggered by an allergic reaction to a particular substance or allergen. Allergens such as pollen may be seasonal, but allergens like dust, mold, or dander, skin particles shed by animals, may affect you year-round, causing perennial allergic rhinitis. It's the job of that intrepid medical sleuth, the allergist, to track down that offending allergen and help combat its effects. An allergist is a physician specially trained in allergy detection and treatment. The first step the allergist takes in the detection process is the compilation of a detailed medical history and a thorough physical exam. This includes a study of the patient's living habits, home and work environments. Perhaps the allergy sufferer works in a dry, dusty environment, or is often exposed to damp and moldy conditions, or is an avid pet lover. An environmental study helps determine what possible allergens the patient is routinely exposed to. The most common diagnostic tool beyond the medical history and exam is the skin test. Suspected allergens are applied to the skin or injected into it. Reactions to the substances are then studied to determine which, if any, are triggering the allergic response. Most year-round rhinitis-causing allergens are airborne, and one of the most common is contained in everyday household dust. Surprisingly, the dust itself may not be the culprit. A major enemy is a creature that lives in it, the dust mite. This is a microscopic, spider-like animal straight out of an old Japanese horror picture. And thousands of these beasts may be living in your house right now. The dust mite's eating habits are as grisly as its looks. This gruesome animal's diet includes the minute skin scales all animals, including humans, shed daily. The dust mite is, unfortunately for us, very amorous. In its lifetime, each can produce over 300 offspring, who in turn can do likewise. This makes them nearly impossible to eradicate. The dust mite's favorite living quarters are dusty nooks and crannies, carpets and rugs, curtains, and, worst of all, beds. Dust mites find mattresses and pillows especially cozy. The strongest weapon against the dust mite and many other allergens is environmental control, eliminating the offending substances from the patient's home and work environment. In the case of the dust mite, this may involve removing carpeting, drapes, upholstered furniture, and other dust-gathering articles. Laundering bedding more frequently than usual, cleaning floors and furniture daily, and installing air conditioners and air cleaners to remove from the air substances which stimulate the dust mite's growth. Mattresses and pillows can even be encased in special airtight covers to isolate the allergy sufferer from the mite. These covers may be prescribed by a physician. Certain allergens, such as pollen and plant spores, are more difficult to control environmentally. In cases where environmental control is difficult or inadequate, the allergist may prescribe immunotherapy, allergy shots. The shots, over a period of time, help the allergy sufferer build up a tolerance to the offending allergen. In almost all cases, whether or not the specific allergen is successfully isolated, allergy symptoms may be controlled, at least temporarily, by medications such as antihistamines. So the next time you wake up with a runny nose, stuffy head, and stubborn cough, don't presume you've caught a cold. You just might have allergic rhinitis. See your allergist.
If you would like to receive additional free information on allergies, please write to me at the Skin and Allergy Medical Group at the address that you'll see later on in this program. Well, that's our program for tonight. I'd like to invite you to write to me at my Dermatology and Allergy office in Yuba City with your suggestions for areas and people that you'd like to see on this program. As you know, the Medical Explorer is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at my Skin and Allergy Medical Group of Yuba City at 367 Del Norte Avenue, Suite 4, 95991. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices right here in the Yuba City and Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.